A healthy life starts when we're young, and having the right kind of medical care is the foundation to becoming a strong adult. So throughout the show, we're going to share with you incredible specialty care offered at Providence Swedish. So join us as we spend the next hour exploring the pediatric services that save lives. New Day starts now.
It's a new day.
Now from King 5 Studios in downtown Seattle, this is a special presentation of New Day Northwest, sponsored by Providence Swedish. Here's Amity and Treasy.
Good morning, my friends, and thank you for joining us for this special presentation of New Day Northwest, sponsored by Providence Swedish. Now, during our show, we're going to explore the many life-saving services that Swedish pediatric doctors, nurses, and specialists provide to kids every single day. My kid included. In fact, my son's very first experience at Providence Swedish was happening on the day he was born. That's right. Look at that guy. He's gigantic. Does he even look like a newborn to you? He was 9 pounds, and because of his size and my size, labor was hard and at times very scary. He was in fetal distress at one point, which put me in like maternal stress. And all the doctors and nurses, though, they were incredible. They made me feel like everything was it was going to be okay. And it was. After many hours of labor and maybe a few choice words, the incredible labor and delivery team at Swedish helped me give birth to this beautiful, healthy baby boy. Isn't he the cutest? But the birth of our lives is just the start of our health journey. And that is why we are so excited today that we get to spend the next hour talking about the importance of our children's health and the unique specialty services available should your child ever need them. And really, I could not think of a better guest to kick off this special hour than Dr. Elizabeth Mead, Medical Director of Education, Outreach, and Quality. Now, whether you're new to parenting or not, this is the person you want to have at your back. Dr. Mead, you know, as a journalist, you have been my go-to for so many questions about children's health. So we're so glad to have you here as one of the many incredible pediatricians coming from Swedish. So
thank you for having me.
It is always a pleasure to see you. So let's just start first with kind of give us an overall glimpse at the pediatric program at Providence Swedish.
Oh, sure. So I had both of my kids at Swedish as well. And I think one of the unique things that really sets us apart is that we kind of do that care all the way from birth up through pediatric life till you turn 18 and then even afterwards as an adult, right? And so we certainly have a very robust labor and delivery birth program. Tons of people give birth at Swedish. We also have a lot of pediatric programs should your child need additional care after they're born.
Which is so important.
Which is so important. So we have a level 4 neonatal ICU, one of the only ones in the state that can provide really state-of-the-art care if your baby needs NICU services after they're born. We also have a pediatric inpatient unit if your child needs to be hospitalized, and that can be anywhere from after they're discharged from birth up until the age of 18. We have a pediatric ICU, and then we have lots of pediatric specialty doctors, so surgical specialists and medical specialists, as well as services like pediatric therapy and child life and all sorts of things to really kind of round out the medical care.
So comprehensive.
Yeah.
So many things. Let's talk about inpatient services. So my son might have to come in and get his tonsils taken out. And I'm really nervous about that whole process.
Yep.
So what are some of the common fears or concerns that parents like me have when their child is hospitalized?
I think for any of us that's a parent, primary is always, is my child going to be okay, right? But once that's answered, I think people do tend to have some secondary questions and concerns. And so one of those often is my child going to be in pain? Are they going to be scared? Are they going to be in distress?
Yeah.
So we have lots of things we do to try to mitigate that. You know, certainly medications can be helpful for pain and those sorts of things. But we also have a lot of services like our child life specialists that really are devoted just to kind of developmentally appropriate behavioral and emotional caregiving for the kids that are hospitalized. So lots of things like distractions and fun activities and different activities that we can do to really make sure kids are as comfortable as possible. And then I think parents also want to know, will I be able to stay with my child? And the answer is almost always yes.
Okay.
So with the exception of our NICU, every room that we have is an independent room, so there's only one patient. Both parents can stay if they want to stay 24 hours a day.
Yeah.
We really want your child to feel as safe and as comfortable as they can.
I've actually seen the rooms where the babies, if they have to stay longer, there's like a bed for the parents. Like I've been in there and it's very comfortable and it's very nice. Luckily, it hasn't been for me personally, but as a parent, who should I expect to see on my child's care team? Like who's part of that team?
Well, it's a big team, so I think that can also feel a little bit intimidating for people if you don't really know what to expect. So I think it's a great question.
Okay.
Certainly you'll have your child's kind of primary doctor. That's the one who's responsible for all of their care and coordinating that care. You'll have a nurse who's really dedicated to your child, and that's called your bedside nurse, so you'll meet that person. And then we have charge nurses and other nurses that kind of help out, that may be floating around and taking care of your child as well. If they need a pediatric specialist, like a surgeon or another doctor, they'll meet them. And then, like I mentioned, some of those other services like Child Life, we have dietitians, we have lots of other folks, pediatric therapy team, who may come in and interact with your child as well. But the way that we do rounds at Swedish is we do what's called family-centered rounds.
Okay.
So each morning, the whole team walks around the unit and sees every patient and family face-to-face to make sure they can really get all of their questions answered with everybody there, so they're not having to repeat the same questions every hour, which I think any of us who have been in the hospital know can happen sometimes.
You're like, yes, it's this, no, it's this. Okay,
Yeah.
That's awesome. I've always wondered this as well. Is there a difference in training or knowledge with hospital-based doctors compared to, your clinic doctors?
Yeah, it's a great question. So generally, yes, it depends a little bit on which specialty. Every pediatric doctor has a foundational training in pediatrics. So that's several years of training just in seeing kids, again, birth to 18. But then our specialists and our NICU doctors and our pediatric ICU doctors do additional years of training just in that discipline. So that's really focused training in whatever unit they're working in. And they have really, really specialized advanced training in how to care for kids that are acutely ill, for example.
Yeah, and that's so important. And that's kind of the reassurance you really want to have when you're in that moment.
Absolutely.
It's
right. You want the most
terrifying.
experienced person to be there for sure.
Right, right. So what can parents do on our side to help kids cope with an illness or, let's say, a hospital stay?
I think kids really want to know what to expect. And sometimes we don't do a great job at being super honest with them because we want to protect them. But I think our team is really good at helping parents understand, well, what's the kind of developmental or age-appropriate way that we can be honest with the child about what's happening and tell them what to expect, tell them what's happening, tell them what's going to happen so they're not surprised. I think it's really a disservice to kids when we say, it's not going to hurt, and then we do something that hurts. Or we tell them it's going to be fine, and then they're going through something. So I think we're as honest as we can be in a way, again, that's sort of developmentally appropriate. And then again, as much distraction as we can have. So lots of activities, walking the hallways, having people come and visit. Therapy dogs. We have therapy dogs that come and visit the kids. So there's all these things that we do to try to make it more comfortable. But then I would say, too, if you as a parent, you know your child the best. So if there's something that you think would particularly make your child more comfortable or feel safer, please tell that to the team. We really want to take individual care of each patient and make sure we're doing everything we can to really address their individual needs.
Yeah, I think the iPad would just...
I mean, all rules go out the window, first of all, when you're hospitalized. So it's screen time, it's juice, it's popsicles, it's like all these things we try not to do as parents. The rules go out the window. We want to just make it as safe and fun a place as it can be.
That's such a really good, important thing to do. I've always been grateful for how well all the departments at Swedish work together. So how does the team of specialists collaborate with, let's say, the primary care physician where that everything starts?
I think this is one of our greatest strengths, and I really think it's one of the reasons I came to Swedish and that I've stayed at Swedish. It's such a tight-knit team of people. The communication between specialties, between hospital doctors and outpatient doctors is excellent. So we will tell your child's primary care provider when they're admitted to the hospital. We'll tell them when they go home. We'll send them the notes in between. And then there's lots of communicating via our electronic health record or phone if someone's not on that system to make sure that your child's provider knows what's going on so that you don't have to, again, reinvent the wheel when you go to follow up with them after discharge. That's one of the things that I think is most important is that line of communication so that the care is really seamless after you're well enough to go home.
Yeah. Speaking of the online communication, there's an app now. I just got alerted and I downloaded it, and it's so easy to use.
That's right. Yeah, we try to really work on that because I think it's one of the barriers for people to feeling like they can get timely care is just being able to communicate well with their providers.
And their providers responding, which is really, really helpful. What sets Swedish apart as a place to see children?
It's a really interesting and wonderful dynamic there, again, because you can be born there, you can get all of your pediatric care there, and then you can continue to get care in that system after you're an adult. And so I think that's one of the things that really is special for us, is that ability to care for someone throughout their entire lifetime. From that birth process, which so many people have at Swedish. Should your child, hopefully not, but should they need any kind of specialty care, that can be had there. And then we can really seamlessly transition them to adult specialists. So some of our kids with chronic diseases, for example, we're all in the same system, and so it's very easy for us to transition that care, make sure there's great communication again, and that it's a comfortable and safe place, and it's not scary or intimidating for that child to then transition to a new set of doctors.
It's so true. Like my son has a pediatric endocrinologist, and that's something that like I wouldn't know where to find the next step when he does turn 18.
Right.
And that's just something that was easily done at Swedish?
Yes, and I think it's something people don't think about. And so sometimes, you know, your kid then gets to be a later teenager or they're off going to college and you're thinking, well, oh my gosh, where are they going to get their care, right? Maybe they're moving to a different city, but if they're staying in the same place within our system, we really can have that smooth transition of care. And I think because we are such a tight-knit team and we all work in the same physical space together, we know each other very well, the level of communication is just different. There's a lot of texting, there's a lot of going to see the patient together, there's a lot of let's all go in the room so that the family can understand that we're all on the same page, we're all thinking the same thing. Because I think sometimes the other problem is when we're in the hospital, we hear a lot of different opinions, and it's hard to make sense of sort of what's actually going on.
Yeah, no, that's so true. My last question before I let you go, where do Swedish pediatric specialists see kids? Is it at First Hill?
And other places, yeah. So
Okay.
our main campus is at First Hill, so all of our pediatric specialists see kids there. But then we also really try to get out in the community and meet people where they are, because I know it's a huge burden for people to have to travel to appointments as well. So many of our specialists go to Swedish Issaquah and also to Swedish Mill Creek up north to really try to get to people's communities, make it easier for them to access care, and just less of a burden to get to so many appointments.
That's huge.
Yeah.
It was so good to chat with you. It's so good to see you. Thank you very much for
Nice to
sharing
see
all
you.
this today. And to learn more about Swedish Pediatrics and what they offer for your family, just go to the website you see right there on your screen.